I am Dr. Rao, Consultant Cardiologist, KG Hospital, Coimbatore. Today we will discuss about the general problems faced by our elderly cardiac patients. What are the various issues our patients in general face when they come for review? Number one, many times we find fractures in the old people, especially patients who underwent bypass operation, underwent angioplasty, and these patients come for us with a fracture of the leg, fracture femur. Why the fractures are increasing in the old people? There are many reasons for that. Previously, the fractures are more common among females, especially after the menopause. Now we will find fractures are also equally common among males also. The reason is we have to check a disease called, test for a disease called osteoporosis. Osteoporosis is a very common disease affecting almost 20 to 30% of the population. Unfortunately, osteoporosis is not recognized by the patients, also by the medical community. Not much importance is given to this condition. What is osteoporosis? Osteoporosis is nothing but a decrease in the density of the bones. Decrease in the density of the bones, especially of the spine, also of the femur, that is the leg bone, hip bone, and sometimes knee bone also. So this osteoporosis is caused by various reasons. Number one is old age. Number two, deficiency of the calcium. Number three, lack of exercise, sedentary activity. Whatever be the cause, the incidence of osteoporosis is increasing day by day in our country, all over the world, especially in our country. And this is the most common cause of fractures in the old people. To prevent osteoporosis, there is a simple test available with us. This is called BMD, bone mineral density. Again I repeat, BMD, bone mineral density. It's a very simple test. It's simple as simple as an X-ray of the chest. It takes only 5 minutes to 10 minutes at the maximum. This test will detect what is the amount of density of your bone of the spine, also of the hip bones. If the score is -2 or more, that means the chance of fracture is almost 10 to 20%. And those patients should take calcium supplementation, vitamin D, and also some of the drugs also available which can be given weekly once or even monthly once can be given. These drugs will prevent further loss of density of the bones, but also they will improve the density and prevent fractures in future. I suggest that any person above 45 years, females after menopause, even males also above 50 years, should undergo at least one BMD once in 5 years or 10 years to find out the status of the density of the bones and to see that whether they are liable to or likely to get fractures in future or not. Second thing is, most of our houses, the bathroom is the most neglected area. The bathrooms are designed by the architects and engineers with the idea of the beauty but not convenience. Convenience is not given importance. Especially when you got old people at home, elderly people at home, your bathroom must be redesigned to see that this bathroom is elderly friendly. What is elderly friendly bathroom? There are many of the fractures, if you see, almost 80 to 90% of the fractures occurs in bathroom. Why a bathroom? Because when you go in the night time, you are half sleepy, half awake, you are not very active, and suddenly there is a water in the bathroom, the floor, and you slip and you get a fracture. And while sitting in the commode and getting up also, there can be slip and they fall because of the old age. You are not able to, your reflexes are not good and your balance is not maintained properly. For that, you need to have floor tiles of the bathroom must be anti-skid tiles. Anti-skid tiles, it must be some sort of it must be rough and not very smooth, not like a marble and all these things. It must be, the special tiles are available in the market. It's called bathroom anti-skid tiles. Please see this. Re-engineering of the bathrooms is especially important, especially when you got old people at home. Second thing is, there must be steel railing where the person can hold the rail and reach the commode, and also while getting up also the railing is necessary for supporting so that the balance is maintained And if you small things like this, height of the commode also is important. If the commode is very low and the old people find difficult to get up and they may fall while getting up from the commode. So the height is also slightly more, and all these things be re-engineered in such a way that there must be adequate light and there should not be dark corners in the bathroom, and it must always be dry, and there must be proper, the surface of the tiles to be laid in such a way that water flows without any obstacles. All these things are necessary. The most important point of the house is a bathroom, and which properly designed, which can prevent almost 80% of the fractures can be prevented by properly ventilated, properly maintained bathrooms. Number 2, we will discuss about the elderly people, especially when they are staying alone and when the relations are abroad and the sons and daughters are abroad and they are staying alone, wife and husband. And I suggest that all elderly people, they must have one family doctor. That is the first and foremost important, because they may have multiple problems. They can have ear problem, eye problem, cardiac problem, joint problem, osteoarthritis. They will not be able to walk, balancing problem, a skin problem. So a patient can have a multiple problem because old age anything can happen. That's why instead of calling a specialist for every problem, they must be attached to one good general practitioner. MBBS practitioner or MBBS or MD, a good family doctor is extremely important to take care of the elderly people. And I suggest that every 6 months you must have a general checkup, which includes a blood pressure, which includes examination of the patient, a blood pressure examination, and a pulse and saturation and weight and symptoms, whether there is any weight loss, whether there is any loss of appetite, whether there is any breathing difficulty. These are all the various questions they will ask you, and you answer all these questions. The routine questions they ask you about 5 minutes, and doctor will examine your physical examination, including all vital signs and everything, and then depending on that they will do a routine exam, a blood test and probably an ECG every 6 months or at least once in a year. What are the tests you undergo? Number 1, fasting blood sugar. Number 2, postprandial blood sugar. Number 3, urea and creatinine, because elderly people, kidney problems are very high. So once in a year, you must undergo urea and creatinine to find out any kidney problem is existing or not. Most important test, according to me, is simple urine examination. A simple urine examination will tell us about any possibility of a kidney failure in future. Suppose some people can get proteinuria in the urine. The proteinuria even 1 plus, some people get 2 plus or 3 plus. Even 1 plus is dangerous. These patients may get in future kidney failure. So if you get in urine examination, simple test, any urine examination. If you do urine examination, if there is a protein is positive, you must consult a nephrologist or a urologist and get appropriate treatment. Most of the times, a urine albumin is because of the uncontrolled blood pressure. In that situation, probably you can buy a BP apparatus and check the BP daily once, morning and evening 2 times, and for about 10 to 15 days, make average reading and then go to a doctor, show the BP readings. Why I am telling for 15 days? Because many times a single reading of BP may be high. One single reading of the BP is not at all important. Whenever you find BP is high, always recheck at least 10 to 15 times and different times of the day, preferably by yourself, home reading, or home reading is not possible, go to a nearest doctor and check the blood pressure. Second important point is, whenever you check the blood pressure, always ask the doctor to take a second reading. First reading, please don't write the first reading, please discard that. Second reading is important. The interval between the first and second reading must be at least 2 minutes. Wait for 2 minutes, relax yourself, and second reading you must let them take second reading and note down that reading. That is more important. First reading is not important at all. You will be surprised to know always there will be 10 millimeters difference between the first and reading. So if you go by the first reading, you will have a high BP readings and probably unnecessary treatment will be given to you. Same rule applies for home reading. I have seen some people buying a BP apparatus and checking daily 10 times, even 15 times. That please don't do that. There is addiction, because there is no need for that. And home reading is not necessary for everybody. There are some people are for anxiety. They get anxiety. They get some depression. They may get some palpitations. Whenever they get any problem, they go and check the BP and they say BP is high. That is not correct. So BP may be there, high BP, because of the underlying anxiety reaction. Anxiety does not mean that you got the blood pressure. It will be a temporary reading. That's why please don't go by a single reading and declare yourself as a patient of blood pressure and get unnecessary treatment. Whenever there is a blood pressure is high, always take a multiple readings. If the multiple readings are not possible, you can go to any hospital. There is a test called 24 hours ambulatory blood pressure monitoring. Again I repeat, 24 hours ambulatory blood pressure monitoring. What is the meaning of that? They will fix the machine on your arm, a BP apparatus machine, and this machine will record automatically without your knowledge every half an hour or so. So that means next time you come, you will remove the machine and see the readings. You will have at least 100 readings at different times. If the reading will be there while you are walking, while you are talking, while you are going to the office, while you are in a meeting, while you are eating food, except taking a bath, all the other times the reading is multiple reading, because what happens is that when you come to the hospital, only one reading is taken. But sometimes when you go to the office or working place, there can be stress during working atmosphere that can cause high BP, and it may cause kidney failure or heart failure. That's why a 24 hours blood pressure measurement is extremely useful for those patients who has got a protein in the urine. Whenever there is a protein in the urine, please don't neglect that. A simple test called urine examination will tell us about what will be happen to the future, whether there is a possibility of a heart attack, possibility of a stroke, possibility of a kidney failure. And whenever you find a protein in urine, you must do one more test called microalbumin, urine microalbumin. That is the most important test. According to me, is very important test, especially for diabetics. Every diabetic, they must undergo urine microalbumin once in a year. If the microalbumin is high, that shows that 2 points. One, your sugar is not controlled and kidneys are getting damaged. Number two, your blood pressure is not controlled and kidneys are getting damaged. In that case, control the sugar and control the blood pressure. If the blood pressure is not controlled, and even if you control the blood pressure, still proteinuria is still there, then you must go for 24 hours blood pressure reading and find out what time is BP is not controlled. I have seen many times daytime BP is controlled, but nighttime is not controlled. That's called not dipping, non-dippers. Non-dippers means nighttime BP is high, morning time BP is normal, nighttime BP is high, and those patients will have a lot of issues for the blood pressure of the issues of the kidney and the heart. So, in my opinion, whenever proteinuria is found, a simple test called 24 hours blood pressure testing will give information whether the blood pressure is high in the night time or it's normal. If that is the case, if the BP is high in the night time, we have to give medicines in the night time around 10 o'clock or before sleeping. That will control the blood pressure effectively in the night time. The elderly people, when they go to toilet, I request them to see the color of the motion, especially when they are taking a pills called aspirin or antiplatelets, clopidogrel. This blood thinner sometimes can cause mild bleeding in the stomach, maybe ulcer, stomach ulcer, duodenal ulcer. It will cause mild bleeding. A mild bleeding will not cause red color of the motion, it will be black color, because by the time the motion goes through the intestines, it gets transformed into black color. Suppose you find a black color motion, please report immediately to the doctor. That means there is a bleeding in the stomach. Black color motion can also occur when you are taking iron tablets, not B complex, iron tablets like Levogen. All these tablets can cause, iron tablet can cause black color motion. Even then, if there is a black color, sudden change in the color of the motion, it's always better to consult a doctor and do a occult blood in the motion, and if the occult blood is positive, then you have to consult a gastroenterologist and undergo endoscopy and colonoscopy. It could be sign of early cancer, or it could be sign of early gastric ulcer. Whatever be the reason, it may. If you don't do that, then in the course of time there will be fallen hemoglobin, anemia. If you get anemia, then you will find difficulty in breathing. Your heart is affected. Your internal organs will be affected. So one of the main important point is whenever you pass motion, and please have a look at the color of the motion. If the color is black, please report this matter immediately to your doctor. So this is all a various screening tests. It doesn't cost you much money. Only thing, you have to do it once in a year. And sometimes X-ray chest once in a year or once in 2 years. A chest X-ray also will be useful. In the same way, abdomen scan is the most useful test. Many people come to us for master checkup. They don't have any symptoms, but when you do abdomen scan, you will find some tumors of the kidney, or tumors of the liver, or tumors of the intestine, cancer of the colon. You will find routinely, and we operate those patients and they are totally alright. Suppose, imagine if they have not come to us for master checkup, imagine we didn't diagnose this disease. After a few years, probably they would come with metastasis and their life is going to end. In that way, a simple chest x-ray, abdomen scan, a blood test called blood sugar, urea, creatinine, a cholesterol, this is more than enough for routine examination. In case if you get a weight loss or any liver problem, you can do liver function test also can be added. All these things can be done at the maximum 1,000 rupees in a year. This is worth investing, especially because you are old, you are staying alone, and it's better to take care of the health by yourself doing a simple test like this.